Democratic candidate for Congress in Virginia's 5th District, Dr. Cameron Webb. Dr. Webb, as a doctor who spends his weekdays treating patients at the University of Virginia Medical Center and your weekends campaigning, you might have a thing or two to say about the president's response to the coronavirus that might counter his claim that we are rounding the corner.
Well, thanks for having me. First of all, I would just say the data is telling us, I wouldn't call it rounding the corner. Certainly Dr. Fauci is describing a lot of the reality of this experience is that, we have to lean into the public health facts. And I think that that's something that you can't argue. We're still seeing an uptick in cases in so many states. Our 7-day positivity rate is a little higher than it was just a few weeks back. And we're still seeing 57,000 new cases across the United States every day. So I wouldn't call it rounding the corner. I would actually say I'm working in the coronavirus unit tonight. And I can tell you this, we are hunkering down, preparing for this cold and flu season and the impact it's going to have on COVID.
So you pretty decisively won a 4-way Democratic primary in June in Virginia. What are you hearing from voters? And is coronavirus top of mind for them as you head out on the campaign trail?
Yeah, I am hearing from voters that coronavirus is top of mind, but I'm hearing it in two different ways. I think that I'm both hearing that the health concerns are top of mind to folks, and they're really worried about kind of what's happening in our community, what's happening in terms of health outcomes. And then I'm also hearing that folks are really concerned about the economic impact. And that's playing out in education, that K-12 education space. That's also playing out in certainly our health space and folks having access to the care that they need. But small businesses are hurt. So everybody's talking about COVID and how it's impacting their lives. It's certainly top of mind. And I think that being able to speak to that with some expertise has been really valuable for us in this campaign.
Dr. Webb, it's Willie Geist. Good to have you on the show this morning. You are a highly regarded young doctor at the UVA Medical Center. So what made you want to leap from medicine into politics?
Well, it's part of the same passion. I'm passionate about serving people, and I'm passionate about building consensus. Actually, before joining faculty at the University of Virginia, I was working in the White House, and I worked both in the Obama White House on the White House healthcare team and on his My Brother's Keeper initiative. And then I also worked in the Trump White House under the Domestic Policy Council healthcare team. And so between those two experiences, just realizing we've got a lot of levers in our federal government we can pull to improve lives for individuals, and just continuing that thread, it led me down this path of running for office.
And where would you be, Dr. Webb, if you were in the House of Representatives right now on a stimulus package, another round of stimulus for COVID? As you know, a lot of people in your district and districts across the country are hurting badly. Small businesses are either shutting down or desperately waiting for some relief from the government. How are you looking at the economic crisis that comes with the public health crisis?
It's critical that we get more stimulus dollars to our communities. And, I've been doing a small business tour around our district for the past couple of weeks. And what we're seeing is that businesses are running out of those dollars from the CARES Act. I think folks are really hurting. Individuals need resources, families, small businesses, our communities. Hospitals need resources in so many instances, particularly rural hospitals. And so it's, we're recognizing that states and localities need additional assistance. So I'm really hoping that a deal is imminent between the Speaker and Secretary Mnuchin, but however we can get this done, we have to deliver for the people.
Dr. Webb, Gene Robinson with the Washington Post has a question. Gene?
Kevin, just one question. How is early voting going in your district? What are you seeing? Who's voting? What's happening?
Yeah, early voting is going really well. In fact, on the ground, we're seeing that some of the numbers across our congressional district are higher than we even anticipated. In the 5th congressional district in Virginia, it's larger than the state of New Jersey. So it's an enormous congressional district. It includes both Charlottesville, Virginia, the area where I live, all the way down to the North Carolina border. And so we're seeing that early turnout is high. There's a lot of enthusiasm. And so folks are really interested in this election and the impact that it could have on their lives.
And what sort of reception do you get in the more rural parts of your district? Charlottesville would seem to be, a place friendly to a candidate like you. But what about the more rural parts toward that North Carolina border, which are very conservative and have been voting Republican for a long time?
Well, keep in mind, I'm from Spotsylvania County, Virginia, so I'm from a rural part. Grew up there. My wife is from Appomattox County, Virginia, just down the road. So we came back to Central Virginia because it's where family is. services. And so I think that in a lot of ways, we're able to connect with folks in all the counties across this district. But I'll also say that we're talking about the issues that really matter to voters most. And so we're talking about those everyday, kitchen table issues like education, like jobs, like healthcare, and how it's affecting their bottom line, how it's affecting their wallets. And people care about that. And so, folks are going to our website. It's www.drcameronwebb.com. They're checking that out. They're seeing, exactly what we're saying about the issues, and that's what's leaning people in our direction.
All right, Dr. Cameron Webb, thank you so much for being on with us. We really appreciate it.